that the government has deliberately underfunded health, not to the tune of a couple of million or a couple of tens of million, but to the tune of 1.3 billion, according to the HSE CEO. That is the reality of it, that he is saying that he's going to deliver a service plan to you that will say that we will have to go over budget next year by €1.3 billion. Why? Because you and your cabinet colleagues decided to cook the books when it came to health. You decided deliberately not to provide the additional resources that were required, just to stand still, to leave the chaos that we have in the health system at the same level this year as it is next year. You didn't even do that. So you've made the announcement over and over again, Minister, 1,500 beds. Where are they? When are they going to come on stream? Because you've funded none of them. You've talked about national programmes, yet they can't be funded. We talked about ADHD clinics, where they've been announced 2 years ago. How are they going to be funded? You have cut health to the bone in terms of what is needed. The consequences will be these people in my constituency, in a hospital that is already in crisis, where the GPs, nearly to every person, has written to you, to the consultants, 11 of them, saying we are talking about service collapse, and you've decided to underfund that service. It is absolutely shameful, at a time when the government announces a budget of €14 billion, that you do this to the most vulnerable people, patients in my constituency and elsewhere, up in their 80s and 90s, who will be languishing on a trolley or a chair because the support isn't there. The beds are not being funded. It is a disgrace, Minister, and you need to change course.